Welcome, everybody, back to the Autism Exchange podcast. We want to
Hello.
communicate and collaborate. We want to have conversations for families and for professionals. Our goal is to have real talk with real sharing, and we want to do that in a way that is really relatable. So we welcome you back. We're excited to keep rolling on this train. I think we've had a lot of good stuff happen so far.
Agreed.
And so we're pumped. Janice, how are you? What's up?
I am good. I'm always, I think, elevated by about, 75 points when it's sunny and warm outside. So it's gorgeous out there, and that always sort of reframes the day.
And you told me two double espressos. That has something to do with that as well.
Okay,
Let's
I
be
was going to
honest.
mention the sunshine, but thanks for bringing in the double espressos.
You're welcome.
I
Whatever it
appreciate
takes to
that.
get going. It's just like your favorite movie when we had that conversation before. We're talking about your film club,
Right,
FILM film,
right.
and
Thank you for
not
clarifying.
foam.
Yep. Right, right.
And I'm like, "What's your favorite movie?" Completely threw you under the bus. And I got to be honest, I had like a brief, because you know me, a very
Yeah.
brief moment of remorse, but then I'm like, nah, because I would say to everybody, like, and I've seen your pre whatever website, right? Like, it's
Yep.
not up, but you showed me and then, like,
Yep.
gave me a lot of detail. You know your stuff, and so like, I thought, man, I put her in a spot. But then again,
Yes.
that's as I do. But you did list the English Patient, which I have since looked up. I haven't
Oh,
watched, but
okay.
so you did deliver.
Well, I thought it was a little bit of a gotcha, which was surprising because I wasn't expecting for a woman who owns a film club business to have a gotcha about her favorite film. So I thought that was kind of funny and humbling, and I thought I was going to be ready and have a whole list of films next to me. So,
Well,
but
for that reason, I'm not asking you about it today.
that's what I figured. That's what I figured. But you know
uh,
what? I can guarantee you that for the next, I don't know, however many times we do this, that list will be next to my computer every single time, just in case.
Therefore, it will never be brought up again. Well, I'm glad things are going well. Yeah, we're having great weather here too, and I guess it might take a stormy turn later. But when it's warm like this, who cares? When
Yeah,
it's warm
exactly.
out, you take rain, it's fine as long as it's not freezing cold. So,
Yeah, yeah. I want to ask you, do the animals seem to notice when it's warm out? Do they seem to be sort of like more active, or what is that
yeah,
like on the
they,
farm?
they do. The, well, obviously, chickens won't lay eggs if it's super cold. Well, not even cold, but in the months when it's dark most of the time.
Yeah.
Like they have little receptors that tell them, like, it absorbs sunlight and helps with egg production somehow. But
Okay.
in the darker months, they don't lay as many eggs. So I have 40 something chickens, and we might have gotten one or two eggs a day during the
Oh,
winter.
wow.
But
Wow.
now that it started to warm up, we're like 20 something a day. So
Oh,
catching up with all the orders from people who've been asking me all winter, like, where's the egg? Now, horses, for them, they don't, I have three, and they love to just get out and roll in the snow. It is almost like they like it. They
oh,
have shelter,
wow.
but they choose not to go to it. But the big thing for them in terms of their activity is, like, when it's warm and the grass is growing, they're not glued to hay. So they love just like kind of foraging, running around the pasture and
Okay.
that sort of thing. So it's a lot more fun to watch because they're
Right.
not just standing at this big hay bale all day,
Right. Okay. That's interesting because where I drive down 440, there's this big pasture, and I always see horses out. And it's been pretty cold actually in Raleigh here the last couple of months. We've even had a little bit of snow, and I always see the horses outside in the snow, and I'm thinking, oh, why isn't anybody letting them in someplace? Don't they need to be sheltered? And
Hmm.
now I'm hearing like, oh no, no, they'd actually prefer that. So I'm gonna have to, apologize to whoever it is that I was shaming
Well,
for
you,
asking
you
that.
you know someone has a huge heart when you see a horse with a blanket on it. Outside of maybe
Yeah,
like $1 million thoroughbred, like, I
right,
don't own a blanket for my horses. Like, they can go in the stall if they want to. They're
right,
fine,
right.
But
Well, that's because you believe in self-advocacy. That's why you're not.
well, that's what we'll call it. Not
That's
not
right.
not the fact that a blanket's like $500.
Right. No, no, no. Self-advocacy. I'm telling you, that's the way it is.
I like it. Well, I'll let you carry on, but I'm really pumped for
Sure.
today. I think it's going to be a great conversation.
Agreed, agreed. Michael, we have a really amazing guest today that I think is here for a conversation that I think I've been wanting to have for years and years in my clinical practice. So I'm really excited that like today's the day that I we get to sort of have this conversation. So we have Dr. DeAnna Grubbs here. She has her medical doctor degree from University of Kentucky, and she did her pediatric residency at Greenville Health Center in South Carolina. Right now, she's a general pediatrician at FQHC, and I'm going to have her explain what her daily duties are and what she does and the families that she works with. But without further ado, we have so much that I think we want to talk about, and I just want to get started. So, Dr. DeAnna Grubbs, welcome to the Autism Exchange. I'm so glad you're here.
Hi, thank you for having me. I'm excited to be here.
I'm really excited about it too. And Janice, can you pronounce FQHC as a word? Or maybe we shouldn't, because that might come across as explicit.
Michael,
No,
thank you for
I'm
bringing
kidding.
that up. No, I do not.
I'm kidding. Federally, I'm guessing here too. I'm doing this because I think this is the conversation that we want to have. Like we take those things for granted. FQHC, federally qualified healthcare center.
Yeah, I think health center. I don't know.
Health center.
Care technically.
Okay, all right. I get 2 bonus points for accidentally getting something right.
So yes, yeah, I work at what's called an FQHC, but we started out as a private practice when I first joined this group, and then we joined an FQHC, which just changes things a little bit in that I think it opens up access a little bit more for our patients, because we take all comers. We don't have to be limited a whole lot by insurance, what you do have, don't have. They are able to take like cash pay patients and use like a tiered pay scale. So if you are uninsured and don't have the ability to pay a lot, then the company is able to work with you on that. So it's nice to be able to be open to all. So that's good.
That is good. And
That's
shame on me
amazing.
for, again, Janice, this is an accident. Like, I'm just making a joke about FQHC, and now I'm already thinking, well, I did the favorite movie thing, and now I'm doing the FQHC thing. Shame
Oh,
on
I'm
me.
keeping score. Don't you worry. That's
Okay, good. Give me
Right.
back. You know, if I can dish it, I can take it. I would have targeted DeAnna, but she already knew the answer. So, but seriously, shame on me for jumping into the professional healthcare stuff first, because DeAnna, what we want to start with is our goal in the Autism Exchange is just you as a human, what you do for fun, what you love, and that sort of thing. So, ready, set, go.
Okay, so I'm a mom of 2 little boys. I have an 8-year-old and a 5-year-old. My 8-year-old is maybe neurotypical. You know, maybe he has ADHD. We'll see. But he is, he's overall, I would say, basically neurotypical and wonderful kid who just so funny and fun and great kid. And then I have a 5-year-old. My oldest is Smith. My youngest one is Riley, and Riley has Down syndrome, and he is absolutely amazing. Just the cutest little dude, and he's so fun and funny. He brings his own set of challenges and a whole different personality than my first one was. It's been a learning experience for me for sure. But those are my boys, and they are my world basically. But and I'm married. I have a great husband, Austin.
Oh yeah, him.
Yeah, him. Michael loves him. So,
Wait, excuse me. Did you say you have a great husband often, or what did you say?
Austin. His name is
Oh, Austin.
Yeah, maybe I
That was
should
like,
say
oh
Austin.
my goodness, that's, the odds are in your favor. Okay, never mind.
Yeah. Austin.
That's
yes.
good.
And then, of course, I am a pediatrician, a general pediatrician, which is what I do all day, 4 days a week, and more than that sometimes. And then for fun, I mean, I love to run, I love to read, I like sports, honestly, travel. I like to do a lot of things.
Well, this is where, and I guess for disclosure purposes, I know DeAnna, our families are friends, and so I know a couple of things about her that she won't tell you and they're in the realm of sports. Okay. So in Kentucky, you're one of 2 things. You're a Louisville Cardinals fan, or you're a Kentucky Wildcats fan when it comes to college basketball. And the Louisville fans bless their hearts, are a tiny little subset of our state that are up north-ish, and they're just mad they are our little brother. And DeAnna, like me, is a big UK fan. However, you had some medical school experience in Florida, is that right? Or at
I
Florida?
just have family in
Family
Florida.
at Florida. Okay.
Yeah.
So there was some kind of tie to Florida, and she is a closeted Florida Gators fan, which, if you're a Kentucky Wildcats fan, especially of late, is just atrocious. So every time the Cats play the Gators, I'm sending her a text like, "Who you rooting for this time, huh?" She says Cats first, but I don't know.
I'm always going to be a UK fan first.
Until they play Florida.
No, even if
The other thing you didn't mention was puzzles, and I got to tell you that all of us in like both the office and our friends and stuff like that, we play these daily puzzles, and they're like, would you call them, like thinking puzzles, kind of like not super easy, but more like brain exercise type things. And you talking about being humbled by somebody. I have my hind end whipped every single day by DeAnna. When I see her score,
every day.
oh, that's almost wrong. When I see her score, I almost just quit. Like I'm not even going to do it today because there's no way I can get up there. So, very humbling in that regard too.
Yep, I can relate to that. My daughter is 17, and similar to you, DeAnna, I used to be a runner and do all these very physical activity things, and it's great. And but lately, like the past few years, she beats me now, and so I'm like, oh no, I just remember the day when. And so we do Wordle sometimes, and then she'll send me her score. And again, I used to be like, I could beat her, but she was also like 9. But now, like, she just sends me hers like 2. So it's like I peaked in 5th grade math. I peaked in Wordle, and like when she was like, a tween, and I haven't been able to outrun her for several years yet. So I'm gonna just rest on my laurels from somewhere around 2017. I think I'm gonna just end there and say, Mama's tired now. We're good.
You said Wordle, and this is a great example because was it last week, maybe, DeAnna?
I think so. Yeah.
All right, so I haven't picked up Wordle in, I don't know, a year, maybe more. Like I've been doing other puzzles when I had time.
Right.
And DeAnna just out of nowhere was like, "Hey, I had some extra time today, so I did do Wordle," and she got it in 2 guesses. 2 guesses, and I opened and I thought, there's no way I beat that. So I opened Wordle for the first time, and that might have been the last time because it took me 3, and I'm like, okay, I can't lose every day another puzzle. So I just at some point cut your losses.
It's a tough curve. It's a very tough curve, day by day.
Yeah.
But can I just sort of nudge a little bit to the conversation that I'm dying to have here? Is that okay?
Absolutely.
Michael and DeAnna. So I was thinking about sort of a working title for this podcast, and I was thinking about the communication exchange. And the reason why I thought of that is because the 3 of us are all coming from similar but different paths. So DeAnna, you are a pediatrician. You're a mom. You have you're a sometimes married woman with a husband. You have 2 children. One of whom is neurotypical. One of whom has I can't think of the word now. I've lost my words. Developmental disability. And Michael, you are also a father of 2 children. You also have a child with a developmental disability. You are, as far as I know, full-time married. You have
That's
horses.
correct.
I have 1 daughter who's neurotypical. I've worked in the field as a behavior and blah, blah, blah. You can see where I'm going with this. But I imagine when we're all taught, if we had a family sit down and sort of go through 3 sort of interview processes with all of us, we would come across, we would approach things a little bit differently, but also in some ways very similarly. So, DeAnna, I wanted to ask, DeAnna, is it okay if I call you DeAnna instead of Doctor? I mean no disrespect.
Absolutely, DeAnna is great.
Okay. I was just sort of wanting to, I guess, pick your brain about some of the things that that inform your conversations with parents, as with all of your different hats, and how that might sort of inform what you say or the questions that you ask. And just one more little thing I want to throw in here. On our podcast, we talk about something called My Home, My Country. And what that is, if you think about, your identity is your family, it's sort of like your values, how you do things, the rules in your house. Do you take your shoes off when you come in the house? Do you not? Do you, have pancakes for dinner on Monday? Whatever it is, you sort of have your family identity and your family rituals and things that you do. And so when we think about our family, our home, my home, my country, what is it that makes us us? And how do you recognize that in a family when you're seeing them or meeting for the first time, or when you have ongoing relationship with them as you're sort of shepherding them through some different challenges that they might come up with? How do you recognize that and be able to communicate with them in a way that still honors that? Okay, I'm done now.
Okay. Well, let's see. That's kind of a lot. So I think that it is hard to recognize a ton on your first meeting with someone. Really recognizing like what is their home, their country, what makes them tick, what are their rules. Sometimes, you can pick up on things pretty quickly and how they interact with their child, or what they are or are not letting their child do in the room, or if their child is doing something they think is not okay, kind of how they react to that. But I think it's just important for me over time, as I build relationships with families, to understand that. And like I said, some of it is observation. If I walk in a room and your child is sitting on your lap and they don't get up, and you don't let them get up, they wiggle or whatever and squirm, and you hold them still, then I kind of learn, okay, this is how you operate as a family. Like, you are very like, we're not doing this, we're not acting like this, at least in a doctor's office. Now, they might be very different in their home, because I will tell you that I expect my kids to act a lot differently in a setting like that, in an office setting, than I would at my home. Versus like if I walk in and the child is playing with a phone or tablet or whatever, and the whole time, and I have to ask them to get off just to answer a question or to interact with me, like, okay, this is what you guys are okay with, which, not saying that that's judgment either way, just this is how you guys do things. Or if I have a child that's climbing up on the table and jumping off and climbing under the cabinets and all that, okay, this is how you guys operate. And so a lot of times observing, you pick things up pretty quickly. And then as you form a relationship with a family, they tend to tell you more and more about things in their home and kind of how they do things. And as you ask questions, you learn what's important to a family and not important to them, and kind of how they operate in their home.
When you were talking about the patients that might climb up on the table and jump off, Dr. Grubbs is so wonderful. She sees my children, so there might be a little influence on that statement from my end.
But I think that's great that, as a mom who has seen pediatricians, it's really nice to know that you said observing, but you're not judging. Like, you're learning about our family, and you're learning about, my home and my country. You're not sort of like judging whether or not you want to cross the border or not. You're just observing and gathering information so that you can ask questions to get to know us over time. I think that's so important, because I know I feel like as a mom, I was always having to get all the information and paint a complete picture on every single visit. It's really refreshing to hear you say that, no, it's an over time relationship, that, there's not, I think what I'm hearing you say is that the visits are snapshots. It's not the entire film. So, like that movie reference, Michael?
I like it.
Okay. So that's really, I'm really happy to hear you say that, like say it so explicitly, because I think that's such an important piece of what parents are going into the doctor feeling like they have to sort of present everything, and it has to be the best and the most, and to have it be the most accurate. So.
Well, if I can jump into, and then DeAnna, I do want you to respond to that. I certainly don't want to interrupt you, Janice, but I think I know there is, as a non-doctor, right, there is this oh, I'm going to see the doctor. You almost forget that they're human beings. And it's like, oh, you're so respected, and rightfully so, right? I mean, you have this incredible knowledge and incredible work ethic, not only now, but just to get to the point that you are where you can start practicing. And I think it's really easy to walk in and feel like only a snapshot because, oh, I'm here for a few minutes. I got to say ba 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 and move on, in hopes that, not that I impress you, but in hopes that you understand who we are. But what's refreshing about what Janice and DeAnna just said was that no, these doctors, especially the great ones, they are taking the time, even overtime, to learn you, to learn about your country, to learn about what's important to you. I mean, early on we had a conversation, Janice and I did, about what is health, what is health care, and I'm a big believer that it's not just, your chemical balances and what medication you may or may not need, sinus infection, strep throat. Instead, yes, that's wildly important, obviously, but in addition to that, it's that I'm happy, that me or my child is able to accomplish the things that we want and need to do. And I guess my statement is, DeAnna is proof that doctors are wired that way too. They are accessible and they care about more than just what medicine you need.
Yeah, and I would say that's one of the reasons I think that we at our clinic, and the general model, there's this model right now that people are pushing for called a medical home. And what that means is basically you come to me for everything, ideally. Like if you are my patient, we try to keep you with me as much as possible. So it's not just, oh, I walk in and I get the first provider available. It's when at all possible, if you are Dr. Grubbs' patient, you see Dr. Grubbs. If you are Dr. whoever else's patient, when at all possible, you see that person. And we want you to come to us as much as possible. And I mean, certainly walk-in clinics, emergency rooms, all those things have their place. And I'm not saying that people shouldn't use those. But when at all possible, if you can see your primary care provider, then they are getting more of those snapshots. They are getting more of those pictures versus occasionally I'll see a patient that is not, actually on a daily basis, I see a patient that's not my patient. This may be the first time I've seen them, and maybe they are just coming in today because they have the flu or they have strep or whatever, and that's all they want from me today. And so sometimes those are quick and easy, and I don't learn a lot about your family. But if you are seeing me month to month or week to week or whatever it may be, I'm learning more and more about you and your family and how things work for you. And so I'm able to see that big picture more versus, oh, well, here's your antibiotic. See you later. Feel better. It's more, how can I help you as a whole family to be healthy? And like you said, I totally agree. Health is not just free of infection. Health is not just healthy weight. Health is your mental health. Health is your spiritual health. It's whatever, is important to you and makes your family, and especially for children, because you want that nurturing environment that they can grow and develop in. Because if you don't have that, then they are not growing into mentally, physically, all the things healthy adults.
I hear a dog barking. How many dogs do you have? Do you have one or two?
One very loud one. I'm sorry.
It's
That's
fine.
behind two closed doors. I apologize.
Don't worry about it. It's life, isn't it? If I was doing this from home, you'd hear a whole lot more than just a dog barking. So don't worry about it. It's all good.
Guarantee that there's something very exciting in the front yard, like that. It's
I'm sure it's a squirrel.
Anything. Yes, yeah.
This is a big squirrel. DeAnna, I completely agree with what you're saying, and I think, tell me if I'm wrong, but every now and then, even with your own patients, like who you are their own ongoing primary care physician, some people do just want it transactional, don't they? Like some would prefer to just, I don't care, come in, give me what I need, send me on my way.
Absolutely.
And I think I don't know, maybe I'm too big of an empathetic person, but like the part of me is like, I think about you and what I know about you and how important it is for you to know someone and that you genuinely care about that entire family unit. I almost feel sorry for you on the day when you walk in and you like put the effort in, and it's natural effort for you. It's not like a forced thing, but then there's like, nah, what do I need? See you. Like that hurts me for you because
I mean, a few of those visits a day makes the day go by quicker.
Oh, that's true. See, optimism. I like that.
But isn't that also information too? Like that may be all the bandwidth that they have that day, whether because they're not feeling well or because, I mean, I don't know, but like it could be frustration, embarrassment, they're having to fit this in a schedule that is overwhelming because of, whatever things. Like it's kind of like the old behavioral term, a non-response is still a response. And it's sort of like, I look at that as information too, when, we come across someone who's maybe a bit surly at the store or something, or, one of my daughter's friends is being a little nudgy. And I'll say, well, maybe, she spilled her cereal this morning, or maybe they were out of orange juice, or maybe somebody dinged that guy's car in the parking lot before he came in. Like, she's like, Mom, stop making excuses for everybody. But if there's a context and, I think if that person is like that over time, I would imagine that that's also information too. And then, and I'm not putting words in your mouth, but from what I'm learning about you so far is I would imagine that then changes how you interact with that person to be careful not to ask questions that person would be overwhelmed by or just, would be too much or intrusive or whatever, that then you learn how to calibrate how you interact with that person, knowing what their limits of disclosure are or whatever.
Yes, absolutely. You definitely learn who wants to talk about things and who does not, or who feels comfortable and who does not. And I would say just in general, like I go into a visit with an agenda, and a family comes into a visit with an agenda, and sometimes those don't always match up. So I just think it's important for everybody to be flexible and everybody to listen, both sides.
Well,
Yep, go ahead, Michael.
No, after you, go.
Well, I was gonna say on that, if as a pediatrician, what do you wish the families knew? And as a mom, what do you wish the doctors knew?
I think, that's hard. I think families, I wish my families knew that that I want them to bring up whatever is important to them. So I don't want them to, because so many people will come in and say things like, okay, I'm going to ask you this question. I know it's stupid, and I know that you think I'm just, like, I had a mom recently, she's like, I know, I'm just a new mom who just is asking crazy questions. And I'm like, no, that's what your pediatrician is here for. If you are worried about something, then you need to bring it to me, because number one, maybe I can just reassure you, oh yeah, that's a totally normal thing for a baby to be doing or your child to be doing, nothing to worry about. Or maybe it is something to worry about and I need to know about it so I can help you. But either way, I want families to know that whatever your concern is, that's my concern too. Even if it is for me to just say, totally fine, nothing to worry about, I can reassure you. I would much rather you come to me and ask me than you to go ask the internet.
Dr. Google.
That would be my big thing. And then I would say, as a parent, I think I've come at parenthood differently maybe than many, because I was a pediatrician for several years before I was a mom. So I guess it's always probably been somewhat different for me as a mom, because I already was, and my child sees, but he does see some specialists. I would say he primarily sees my partner, so they all know me and him well, but he does see some specialists. And I would just say, as a mom, I think that it's important for providers to listen to what's important to the parent. That's what I would want as a mom, is for you to hear me and hear what's important to me, because you may have come at it as, oh, this is what I'm here for today, or this is what you need to hear. But if I'm concerned about something, I want you to hear my concern and address my concern. Even if it's not concerning to you, at least let me know that it's okay. Like, address it, don't ignore it.
That is something that Janice and I have both on the record and off talked about as a trend in all of our hundreds, if not thousands, of conversations at this point, is ask questions. And I think if you were to give me one shot at describing the type of healthcare worker or any other human being, friend, whatever it is, do they ask questions? And that's something that we hear in our therapy clinic. We do that. Like a doctor might, DeAnna, you might send over somebody that says, hey, look at fine motor skill development, and we'll look at that. But still, when we walk into the room, our first question is, why are you here? Like, what's up? And because then you learn so much about that family and why they're really here. And I wholeheartedly agree with you that asking those questions and just listening, both as a parent and as a provider, are wildly important. So if I can transition to another question for you, like Janice mentioned, I am a parent of a child with special needs, and you told us about Riley having Down syndrome. So two-part question. One is, how did motherhood change your practice, which you just kind of touched on? And then after you practiced as a mother, then the addition of Riley, who is, by the way, I know Riley. He is a wonderful, wonderful kid. He's hilarious. By far one of the funniest kids I know. Slightly rotten, am I right?
More than slightly.
But great kid. But anyway, so how did motherhood change your practice? And then with Riley and becoming then a special needs parent, how did that change your practice, if it did?
Yeah, so I definitely think it did. I've even had a family comment on it one day.
Oh.
how they noticed I had changed as a physician after I had children of my own. It was very complimentary, not a negative thing. I do want to say, you do not have to be a parent to be a great pediatrician. I work with some awesome pediatricians who do not have children, and so I don't want it to come across at all in what I say that I think I'm better than them because I have a child.
100%,
or that you can't be amazing without a child. But for me, I think it made me less, here are the rules, here is what you should do. And I think I was somewhat flexible before anyways, but as a parent, I've learned, like, okay, the pediatrician in me says your child must have 2 hours or less of screen time every day. Your child must eat 5 fruits or vegetables every day. Your child should be put down in the crib, awake but sleepy. There's just all these things, like, this is what you should do. And as a parent, I've learned that all those things, kind of my home, my country, all those things don't work for us. Not perfectly, at least not every day, and some of them not at all. And so while some of that is, I'm not saying that that's not important, that you limit screen time, that you don't, that you use it appropriately, or that it's not important that your child eat healthy, but it also is what works for you. And so, yes, there are some hard and fast rules. Like, I'm never going to tell you your child hates the car seat, so you should hold them in your lap in the front seat. No, I'm never going to say that. Like,
no, that's what the truck bed's for, right?
Oh my goodness. That's a hard and fast rule. Rear facing car seat, please. But you know what? If you rock your child to sleep at night, but then you put them down and they sleep all night, then that's okay. That's what works for your family. Or if the way you have to get some fruits and vegetables in their diet is through a pouch of pureed whatever, like, you have to work around what works for you. And so I think that's a big part of it, is just learning to be flexible and learning that if it's not a problem, then it's not a problem, Yeah. And so I think that's a big part of it. And I think I learned more and more of that. And then as a special needs parent, I think I've learned more and more about incorporating, like, your therapist, your specialist, your primary care physician, and how I interact with some of those other specialists, like being more involved, following up on what's happening at the therapist, because when you go to this place and this place and this place and there's this wide disconnect and nobody knows what this person or that person is doing, it's hard. And so as a primary care physician, my job is to bring all that together and be the person they go to help with all of that. Do I know every single thing about their heart problem? No, I do not. And if they come and ask me what's going to happen in their heart surgery next week, I'm going to say, well, you really better call your cardiologist or your CT surgeon and talk about that. I'm not the person for that. But I better know that you're having a surgery, and I better know, like, what's going to be the follow-up after that, or I need to know what therapist you're going to, and kind of how things are progressing there. So I think that's part of it too.
I have a question, and I guess not it's not extremely deep of a question, not an extremely deep question, but is it ever difficult for you? So you talked about going to specialty appointments at university hospitals or teaching hospitals. Is it ever difficult for you as a pediatrician to be at those specialty appointments because you have this great knowledge? You know, you've been through medical school and you've practiced for so many years and you're great at what you do. Obviously, you're not a heart surgeon, right? So if you go to a cardiologist, I'm not saying that you think, oh, I know everything about this. But is it difficult for you ever to, on either side, do the specialists know you're a pediatrician, and how do you shut that off?
I don't think you can shut it off completely. I don't think that's possible. I think when you have done something for a really long time, whatever that may be, it becomes part of you and who you are. And so I'm never completely mom and not pediatrician, nor am I ever going to be completely pediatrician and not mom. Those are both really important parts of me. So there's no ability to shut it off. But I think that we've been very blessed with the specialists that we have seen. And overall, I have had really good trust in the specialists we have seen. And most of them do know I'm a pediatrician because they are people who I refer patients to. So they recognize my name, or I think they put some little flag on your chart or something sometimes.
Yeah.
Sometimes people come in to see me that haven't seen me before and will say something like, you're a pediatrician, or they often figure it out when you're having conversation. And like I said, you can't shut it off. So to some degree, you use those medical terms or whatever, and then they're like, you know a lot about this. What do you do? And so I don't think that it's been difficult for me. I feel like I've had a really good experience for the most part. The only thing I would say has been difficult for me is on the rare occasion, which has only happened really, I think, once for us, where I've not been super happy with a specialist care and I wanted to change and go to a different specialist. There's a little part of like this professional part of me that's going to be like, oh, now they're going to think that I don't like them or I won't refer people to them or whatever because I moved my kid. When really I just felt my kid, it's not that I think you're a bad provider at all. I just think my kid needed something different or a little more specialized than what you could offer me.
We often say that therapists, in our world, we say therapists are like shoes. You can try them on, but that doesn't mean everyone's a perfect fit. That doesn't mean that the other shoe options are bad. It's just there are fits, and it should be a humbly approached thing on both sides of that. So thank you for your insight there. I obviously asked because that's hard for me in a different sense, not a pediatrician obviously, but as an OT with a child with autism, my wife will often ask me, well, what would you say to the kids that you work with? Like, what would you say to their families if they were doing this? And what do you think? And I'm like, I have no idea, because I have to be his dad. I can't be his therapist. I have to be his dad. And it's almost like I know absolutely nothing when it comes to my kids, and it's bad. I don't love that, but at the same time, I would rather be their dad than their therapist. So, I skipped over because I really wanted that question in there, but I skipped over something. DeAnna, you touched on the my home, my country thing, and I think Janice and I want to know, as do a listener or two that we already have, what is your country? What is your home, your country? How does that look? And judge-free zone, like you said. It's as long as it's safe, well, I won't go into mine, but mine's chaotic. I guarantee there's nothing like mine.
I think some things that maybe are not run-of-the-mill at my home, we have rules like bathroom doors have to stay shut. All the doors have to stay shut. To the point where Riley has learned this so much from the habit at our home that he goes around shutting doors everywhere we go. Like, we're walking into Sunday school and he's like slamming the door behind him, and I'm like, no, other kids are still coming in. Leave the door open, buddy. But Riley tends to, number one, he has left the house before one time, unfortunately. Thankfully, he was not gone for 5 minutes before we found him in the neighbor's driveway, so it was all okay. But we know that Riley will just go outside without fear of what's going to happen if he goes outside. So we have we have to keep everything shut and inaccessible. He really loves to flush a toilet, and so if you leave the bathroom door open, you can be guaranteed that he'll be in there flushing the toilet on repeat, and there may or may not be a toy going down the toilet. And so we have to keep like all the doors shut that are not places he needs to be. And so that's a rule in our house. Everything has to be shut. I would say another my country thing, I touched on sleep earlier. In my house, we snuggle a lot, including at bedtime.
Good.
And so,
good.
Even though I would totally tell you if your child is having trouble sleeping, you should lay them down awake and let them go to sleep in their own bed. My 8-year-old still would prefer that someone lay there and cuddle him until he falls asleep. But he can go to sleep without it. So it's okay.
think about when Smith and Riley are 17, 18 years old, and they're thinking about their childhood memories. That's going to matter to them. And like, I completely agree that there are boundaries to everything and circumstantial exceptions, but that's important to me, that the textbook says we should do this, but at the same time, I'm snuggling my kid, and there are physiological and mental benefits to that.
Right. Yeah. I think
I
it would
remember
be a problem if, go ahead.
I'm sorry, go ahead.
I was just saying, it would be a problem if my child absolutely could not go to sleep without me laying there snuggling him, then that's a problem. But as long as he can, and he just prefers it this way, it's okay.
Sure.
Yeah.
So I derailed you. Sorry.
No, but I was thinking that I was really worried from what you were saying earlier, DeAnna, as a behavior analyst, just like when you're a pediatrician, like, all the right things, right? This is what needs to be done. You do this, you do the vegetables, do the sleep, all these different things. And I think as a behavior analyst, I was thinking of those things too, thinking of all the recommendations I've given that were clinically very sound. But then I had my daughter and I was like, it was very different. And I remember, excuse me, thinking about the sleep and about how, she's supposed to go down to sleep when she's tired and let her fall asleep on her own. But I just absolutely loved cuddling her and sleeping and snuggling. And I was talking to a friend of mine and lamenting, oh my gosh, what am I going to do to her? She's going to go to college and not be able to sleep. She was like 6 months at the time or something. And she said, Janice, there are entire cultures and countries that co-sleep as a family. So I think she's going to be fine. And they're not all walking around as zombies because they can't sleep as adults. They figured it out. So trust me, if that's what makes you happy and makes her happy, enjoy, Michael, like what you said, enjoy that time, and you'll figure it out as you go. You don't have to figure out the next 20 years at 6 months of age. And that was such great advice, because it sort of gave me a little bit of a breather that while clinically, intellectually, I might have some of the answers, I don't have that. That doesn't necessarily mean I have to use all that to inform minute by minute decisions with my child. You have to be flexible, and that's part of our country now. So anyway, I didn't mean to interrupt you, but I just wanted to punctuate that a little bit, that I am so happy to hear you say that.
So Janice and I got excited and we jumped into your country explanation. Yeah. So, is there, what else about your country that you want us to know, or that we want to know, frankly?
I don't know. In my country, pizza is a must.
Let's go.
Say that. Pizza is probably one of the most unhealthy foods you can eat. So as a pediatrician, it's terrible for me to say that, but pizza is it's a must in our country. It is consumed at least once a week. It's a food everyone can eat. It's quick. It's easy.
Delicious.
We can eat a salad with it. We usually do. We usually eat it with salad and some berries, so it's not just junk. But but it's just, pizza's a must in my country.
I like that. I like that a lot. I want. Is that? What do you think? Is that like your country explanation, or is there more that?
I think that's good.
Okay. Yeah.
There's probably more than anyone ever wants to know, but I think that's
Well, the big thing, and I'm preaching to the choir here, and I realize that, but the big thing that when we bring up my home, my country, which is 100% credit to Janice, like this is her house thing, and I like, you should somehow patent that or copyright that or whatever, and like write a book about it, because it's so good. But all of that credit to you. But when we talk about my home, my country, what we want to do is identify what people's country laws are or rules are, and then we want to learn how to respect them. And what a unique perspective it is for us to get a pediatrician, a brilliant, great pediatrician, to talk to us about what her country's rules or laws are. And we know good and well that if we come to your house or if you come to ours, that we are going to respect each other's function in our culture and our life. And that's wildly important, no matter what your work is. So I think that's super cool.
Mm-hmm.
I want to reiterate something because we spent a long time talking about being a pediatrician with children.
Mm-hmm.
And I just want to reiterate what you said before and kind of give you an opportunity to expand if you want to. But that is that the message is absolutely not that a pediatrician who does not have children is somehow less than. And if I were to give it a little nugget, a little bullet point of what I took from what you said was that if maybe at most even it just gives you more leniency or a little more understanding of maybe I'll bend the rule just a little bit in this circumstance, but that doesn't change foundationally that you have that knowledge.
No, absolutely not. And I will even say 2 of the pediatricians I work with don't have children, and they are 2 of the best pediatricians ever. One of them they both take care of my children. But
Agreed.
Is there, I mean, I have loads of questions. I don't want to tie you down all day. I was just so thankful for you being gracious with your time. Is there anything that you maybe want to say that you haven't said in terms of a special needs parent, in terms of being a pediatrician, in terms of how Janice and I are asking too many personal questions? Like, we welcome all of that and just want you to have as much a platform as anything else.
I mean, I think like you were saying, you would call this the communication exchange. I think that, that really is the foundation of being a good pediatrician in general is being able to communicate with your patients. And then as a parent, being able to get the help you need is being able to communicate what you need. Because kind of like I touched on earlier about having an agenda. So before I walk in a room, I'm going to look at your kid's growth chart and I'm going to say, oh, this kid's growing great. Or this kid is underweight and they're not growing and they're not gaining weight, so I really need to go in this room and focus on nutrition. Or this kid is supremely off the charts overweight, so I need to go in and talk about nutrition and activity. Or I see that you're way behind on vaccines, so I need to come in and talk about that. Or I see, just whatever it may be, I'm coming in the room going, I've looked at your chart, I've looked at this basic information. These are the things that I know as a pediatrician I think are important for us to talk about today. But you may walk in that room with a question that is not at all in that purview of what I thought we were going to talk about. And so I think you have to be willing to bring that up, because if you don't tell me something's a problem, if you don't tell me your kid's not sleeping, I don't know your kid's not sleeping. Mm-hmm. I'm not going to know that's a problem. And so I think for pediatricians, being willing to be flexible and know that even though this is what I thought we needed to talk about today, if you come in here and you're talking about something that's really important to you and that is really a problem for your child and your family right now, sometimes I got to throw that other stuff out the window for today. Unless it's just really, truly urgent, we're going to have to back burner that and talk about what's important to you today. So I just think being willing on both sides to listen, and for me to be able to shift gears and say, okay, this is this, because there's a list of things I'm supposed to talk about at every checkup I go into. But if you come in and you tell me, my child sleeps 10 hours every night, I don't even ask you how you put your child to bed, because it doesn't matter to me. If they're sleeping well, that's what matters. If your child is growing well and you tell me, yeah, they're a good eater, then I'm not delving into the details of that, because you say your kid's a good eater and they're growing well. So we don't need to spend time talking about that. Versus if I walk in a room and you say, my child sleeps 2 hours every night, it's a disaster, we're falling apart as a family. Okay, we're going to put all this on the back burner and we're going to sit here and we're going to talk about sleep and how I can possibly help you with that. Mm-hmm. And so I think that's the big thing, being flexible and just expressing like what's important to you and what you need. Because if you just say it offhand, like, oh, we're just doing this, like, I may not really recognize that that's really important to you and that we really need to talk about that. So making it clear.
DeAnna, how do you find that parents typically bring to you I want to say this do they know what's important to bring to you so that they know like sleep is the biggest issue and it is genuinely the biggest issue, whereas maybe there's something else that you would want to know about that they're not bringing to you? How do you help parents know what to sort of, just like you said, you know, you have a list of things that you're going to be asking for when you go into a visit. Do you help them, or do they have a list of questions that you hand out saying, when you come into the visit, you should know about these things, or ask me about these things, or a checklist? How do you help parents to stay informed so that they know what to bring to you?
Um, so we have at checkups, now it'll be different depending on what you're there for, but like at
Yep.
checkups up until at least age 5, parents get this developmental screening form that they fill out. And I do feel like sometimes that helps parents bring up, because especially if you're a new parent or somebody who's just not spent a lot of time around children or something like that, you may not know what is a developmental concern. Your child
Yeah.
may be way behind in something, but you don't know. You don't have a frame of reference. And so I do
Right.
think those developmental questionnaires can be a really good starting point for some parents, because I've had parents say to me, I had to answer no to a lot of those questions. Is that okay? And sometimes the answer is yes. Nobody answers yes. Well, okay, some people might, but 99% of people aren't answering yes all the way down the board. But, you know, what are you saying no to? Let's talk about that. Is that okay? Is that not okay? And then, like I said, some of the things are like, I'm going to bring up with you, like, hey, you said your child eats pretty well, but I've noticed in the past year they haven't gained any weight. So let's talk about what that means to you, because what eating well means, I can tell you, is very different from one family to the next, and that is and is culturally tied in too. There are certain cultures that seem to think that their children need to be larger than others, or just different things like that, and so I'm able to kind of draw some of that out sometimes. And then there are some questions that are asked by the person putting them in a room, just some general questions. And so sometimes that'll help drive some conversations as well.
That's great.
I
Thank you.
had, well, I like to make fun of myself. That's a trend here, but whatever. If we can laugh, we can laugh. I was in Lexington working, and I did some home health in pediatrics, and I went into this family, and the family was Indian, and they were cooking. And I was there, like, it's a feeding therapy program. Like, I was trying to help this child, you know, diversify their diet. So I go in, and it smells amazing. And so I'm talking to mom, and we're going on, and I'm thinking, you know, I was super young and like trying to be cool and impressive, you know, as this child I'm working with them on some oral sensory and motor skill, and he's sitting in his high chair. I'm like, so, what you cooking over there? You making like shawarma? And she's like, it's chicken noodle soup. I felt like such an idiot. But you know what? I learned from it. So there's that. DeAnna, one more question from me before I personally will stop bothering you. But
Yep.
tell me about, you just touched on it, the difficult conversations that maybe you have to have with a family that maybe they don't have a clue. Maybe something like autism is not on their radar at all, and you see some serious stuff. Can you tell me a little bit about that conversation and how you approach it?
Yeah, so I would say, first of all, there are times when I do walk in a room for the first time, and I'm seeing a 3-year-old who's a new patient to me, and in the first 10 minutes, I'm like, ooh, I really think this child has autism, or I really think this child is significantly developmentally delayed, or whatever. Sometimes I have to balance what I think a family's ready to hear, because there are times, I think that after spending 10 minutes with your child, if I look at you when you're here to talk about something unrelated, or you're telling me you think everything's great, and I look at you and go, well, I know you think everything's great, but I'm pretty sure your child has autism, that's going to go over like a load of bricks, you know?
Yeah.
And so sometimes, honestly, I don't even bring it up the first time if I feel like this family's coming back to see me, or if I feel like this family's just really not ready to hear it. You know, it's not something like, oh, I think your child has cancer and they need treatment immediately. You know, if I talk to you about this a month from now, it's really not going to make a big difference in the scheme of things. You know, it's not like I can give you a medicine that's going to change this.
Sure.
It's that I mean, yes, you need to know. We need to talk about it. We need to get your child in early intervention. We all know that's such a huge thing, is getting your child in the therapies and things they need. But at the same time, if you're not ready to hear it and I'm pushing it at you, it's not going to go over well. And sometimes those families are just going to disappear and not going to come back and see me anyways because I've offended them. And so I will try to ask some questions that kind of make them think and point them in that direction. But I'm not going to bring up something that I think a family is not ready to hear if I don't, if I don't think it's an urgent need.
That is such a beautiful encapsulation of everything we believe in this podcast. Is you're back to my home, my country. You're learning those people, and that's a skill. Man, that's a skill to do it quickly. A skill that I certainly don't have. But what a skill to walk in, read the room, understand those people at their hearts and their core, and then decide when to make informed decisions about their health. What's priority 1, what's priority 2 and 3. That's a perfect picture of everything I think Janice and I are looking at.
Because if you don't establish that therapeutic relationship, there's going to be nothing therapeutic that happens after that. So if it takes another few weeks or a month, that you then have something that you can work with and sort of draw from later on, like that's that old reference about relationships being a bank, and you have to keep making deposits before you can make a withdrawal. If you don't have that relationship first where you've built up trust and a communication, then there's nothing to draw from later on when they go through, inarguably very challenging times with their family. So thank you for saying that and being candid about that. I think that there's assumptions on both sides about what that process looks like, and I'm really grateful that you are honest about it and in a way that I think goes back to what I was thinking about earlier when you were talking about the challenge that it is to be a pediatrician or any sort of doctor or provider that's really good, where you have a relationship with all of your patients, your families, and the families are, mom and dad and the kids and siblings, and to be that accessible and that open and that connected to that many people. I don't know there are that many people, maybe Taylor Swift, but that many people in the world that are able to be that connected to people, where they feel respected and heard and seen, and that you feel that that's what you're offering them, and that has to be genuine, because if it's not, I really don't believe you'd have very many patients. So I think the fact that you do is because that's who you are, and it's what I and then I'll stop after this, but I do think that being a doctor is a calling. I think you can go to school and learn what to do, but I think that's who you are, is to know how to do it and to know how to relate to people. So good on you. I'm so pleased that you joined us today for the podcast, because I think this is one I'm personally gonna go back and listen to a lot and continue to learn from. And I just I think you're the bomb. So thank you for coming today.
Well, thank you so much. I appreciate that.
I think she's the bomb too, Janice. I think we agree on that wholeheartedly.
Yes.
She's great.
Thank you, Beck.
Okay, unfortunately, we probably should wrap up.
Yep.
Dr. Grubbs, thank you again from the bottom of our hearts for being so candid and open and willing.
Thank
We know
you.
you have a lot going on, but thank you so much. We will continue, like Janice said, to learn from this, as will many, many other people. So I'm
Yes.
super thankful for you for coming.
Thank you so
Very
much.
happy to be here. Thank you for having me.
Maybe we'll do it again someday, because there's a whole lot
Yes.
more to have. All right, guys. Thanks again for joining us on the Autism Exchange podcast. We want to communicate and collaborate. We want to have conversations for families and professionals. This is real talk with real sharing that is really relatable. Thanks. See you next time.
Bye.